Good day everyone, this is Rochi, and for today's video, let's talk about respiratory system and their diseases. But before we proceed, let us define first what is respiratory system. So respiratory system is the network or organs and tissues that helps us breathe. This includes the airways, lungs, and blood vessels. This system helps our body to absorb oxygen from the air so that our organs can work. Respiratory system also helps to protect our airways from the harmful substances and irritants. It also delivers oxygen to the cell in our body and removes waste gases including carbon dioxide from the body when we exhale. The respiratory system has many different parts that works together to help us breathe. This includes the mouth, nose, sinuses, pharynx, trachea, bronchial tubes, and lungs. Now let's start with asthma. Asthma is the disease that narrow and swell the airways and can create extra mucus. This can make it hard to breathe and cause coughing, whistling sound, and shortness of breath as we breathe out. Around the world, more than 300 million people suffer from asthma, and around 250,000 people die from it each year. Asthma affects the respiratory system, particularly the smaller airways such as the bronchi and the bronchioles. These airways have an inner lining called the mucosa that's surrounded by a layer of smooth muscle. In people with asthma, the airways are chronically inflamed, which can make them hyper-responsive to certain triggers such as the tobacco smoke, pollen, dust, fragrances, exercise, cold weather, stress, and even common cold. So how can we prevent asthma? One way is to reduce the presence of triggers. However, exposure of triggers can't be controlled. This is where inhalers, the primary treatment of asthma, came in. This medication helps asthmatic control and prevent asthma symptoms. The next is we have pneumonia. Pneumonia is an infection that inflames the air sacs in one or both lungs. The air sacs may fill with fluids or pus, causing cough with phlegm, fever, chills, and difficulty breathing. A variety of organisms, including bacteria, viruses, and fungi, can cause pneumonia. Symptoms of pneumonia includes chest pain when you breathe or cough, cough that produces phlegm or mucus, fatigue and loss of appetite, fever, vomiting and diarrhea, and shortness of breath. Treatment of pneumonia. Take any medication that is prescribed by your doctor. If your pneumonia is caused by bacteria, you will be given an antibiotic. It is important to take all the antibiotic until it's gone, even though you feel better in a couple days. You also need to drink a lot of water to help lose secretion and bring up phlegm. And also, you have to get a lot of sleep and take your meal regularly. The next is we have lung cancer. Lung cancer results from the abdominal growth of cells in the lining of the lungs, leading to the growth of a malignant tumor. Lung cancer is usually fatal. The overall survival rate is about 17% at 5 years after diagnosis. The main cause of lung cancer is cigarette smoking, secondhand smoke, exposure to radon, family history of lung cancer, HIV infection, exposure to harmful chemicals, and air pollution. In people who display symptoms, this may include the following: persistent cough and hoarseness, shortness of breath, wheezing and chest pain, blood-struck sputum, chest pain, frequent episode of bronchitis and pneumonia, weight loss, weakness, and fatigue. Treatment for lung cancer involves a combination of surgery to remove cancer cells, chemotherapy, radiation therapy, and targeted therapy.